A new e-book is providing a rare glimpse into the lives of nurses from Alexandra Hospital. Entitled Missy Reflections II, the book chronicles mental health issues, the struggles of male nurses, and first-hand accounts from foreign nurses. Joining us to share more about their experiences are staff nurse Samuel Yu and nurse clinician Myint Myint Than. Let's start with you, Ms. Than. You went from oncology care to palliative care. Why did you switch, and were there any difficulties with this kind of transition?
Well, I will share about how I changed to the palliative care. After I attended the specialist diploma in palliative care course in 2016, I was given a deeper insight into caring for the patient with limited illness. Subsequently, and given the opportunity for me to join in Alexandra Hospital to set up palliative ward. To me, it's not so much switch from oncology to palliative care. Instead, it's providing continuity care with different approaches across the illness trajectory. Of course, there is some challenges I face, including stepping out of my comfort zone after 15 years to run out the new environment in Alexandra Hospital. I'm also faced more elderly patients in behavior issue and language barriers. I learned more about caring for the geriatric patient, which I didn't encounter in the past. With these transitions to the palliative care, I have been given the privilege to journey with my patient at the final stage of their life. And currently, I'm working involving in community care in palliative care nursing. I'm very excited to be using my expertise to helping my patient and their family outside of the hospital setting.
All right, thank you, Ms. Than. A quick look at your background there. Let's bring in Mr. Yu. Samuel, now this book, you mentioned, it chronicles the struggles of male nurses. Now, as of figures from the Singapore Nursing Board in 2018, 4,700 male nurses out of 42,000 nurses in total. So very roughly 1 in 10 is a male. Is that difficult for you?
Well, I think that particularly in AH, it's not difficult at all. I always feel very supported by my colleagues and my supervisors, and I feel that gender has never really been a limiting or discouraging factor in my nursing journey. So in that sense, just because we might be a minority, I don't think that it really affects male nurses so much. Yeah.
All right, that's a very positive answer, but building on from that, it does challenge certain stereotypes. Have you ever faced patients who say, well, I'm not so comfortable because you're a man, but after dealing with you, being persuaded by your ways to understand that, in fact, maybe some kind of acceptance in terms of differences in gender might actually improve their experiences as a patient?
I think there's always some initial shock. There's a bit of confusion, especially among the elderly, about whether you're the doctor or the nurse. But then I think I've never had the confusion last for more than 5 to 10 minutes. Because once they get used to the idea that you're the nurse and you're there to help them, I think that most people are just as ready to accept a man as they are a woman.
All right, Ms. Than, back to you. Now, both of you, in fact, but Ms. Than can take this question first. Both of you have been serving in Alexandra Hospital during the pandemic. I'm not going to assume anything. Give me first, Ms. Than, your initial experience and whether you were surprised by anything that happened during the COVID-19 pandemic.
Oh, sure. So during the COVID-19 pandemic, as a frontline staff during this COVID pandemic, we're facing various challenges, such as manpower shortage and high patient acuity. Wearing the full PPE in the humid environment was not easy as well. So as time, we were exhausted and lacking in the self-care. However, we have a great support and encouragement from Alexandra Hospital management. We also working together as a team and looking out and caring each other during this difficult period. Many of us foreign nurses were not able to go back home to visit our families. So we use video call to check in with our family to ensure that they are fine. Sadly, I lost my both mother and my mother-in-law to the COVID-19 in 2020. They were the two of the most important people to me. But I don't have a chance to spend time with them, nor to say goodbye. To me, it's important to focus on the positive side for things during those challenging periods. It's also essential to take care of our physical and mental well-being.
It's
okay to take a break.
Sorry, Ms. Tan. I'll get to Mr. Yu in a moment, but very quickly, if you could tell me, how do you focus on looking after patients during COVID when you lose your mother and your mother-in-law to COVID-19? Correct me if I'm wrong there. How do you focus on the here and now, given what has happened to you? Very quickly.
So with what I did is when I see that taking care of the patient, I treat as my parents, as my mother, because I need to care. Although I cannot able to chance to give the care to my mother, this all our patient is as my mother like that. So I treat it the way. Yeah.
All right. Mr. Yu, your experience during the COVID-19 pandemic.
Well, I joined when it was very much in progress, so it was quite a formative experience for me. But I feel that the pandemic has taught us that despite our very varied backgrounds, especially in healthcare, I felt that we could all come together and we provided quite an excellent service, I think, to the people of Singapore. And I just felt very inspired by this sort of teamwork.
Thank you very much indeed, Staff Nurse Samuel Yu and Nurse Clinician Myint Myint Than. Thank you so much for taking the time to share your experiences with us. Thank you.